More pregnant women here are getting infected with COVID-19. KK Women's and Children's Hospital saw 400 cases. That was in just the first 4 months of this year. Compare that to 300 cases for the whole of last year. And with Singapore easing most of its pandemic curbs just a month ago, the number could continue rising. But doctors reassure that most patients recover well with no serious complications. Sherlyn Sia has more.
35-year-old Fitria was nearly 6 months pregnant when she tested positive for COVID-19. She had mild symptoms like a sore throat and runny nose, but it was her coughing that alarmed her. Constant check-ins with her doctor over the phone put her mind at ease.
I cough, it causes stomach pain. So I asked him. So he says that yes, it will cause some discomfort, when I cough, but it doesn't mean that you're hurting the baby. It's not, because baby is protected. He mentioned that only I were to have any further complication like breathlessness, that's where you call the ambulance. But I didn't have all that, so I just remained calm, I cough, I eat my medicine on time, and I just rested.
Fitria recovered after 7 days, and both mother and baby have a clean bill of health. She's part of a growing group of infected pregnant women who were seen at KKH, brought on by the Omicron wave. The hospital says most can recover safely at home. Only those with high risk or in late-stage pregnancies are admitted.
A few cases, the mother was so severely ill that we had to prematurely deliver the baby. So that the mother can be treated properly. Because when the pregnant mother she becomes ill, there's a risk to both the mother and the baby.
That's why KKH actively encourages pregnant mothers to get vaccinated to prevent severe illness. And after birth, the hospital strikes a balance between infection control and post-delivery care.
As long as she maintains, the masking and all, she can pretty much do, everything that is quite, that would be expected for a mom that's just delivered. So she can do skin to skin, she can do breastfeeding, The important thing is to really maintain that infection control, like the masking, just to protect the baby, and then frequent hand hygiene in between.
That's how KKH keeps transmission risk low. There were only 2 cases this year of newborns getting COVID-19 from their mothers within days of birth.
The ones that we've seen, they actually were fine. They were not really particularly symptomatic.
Moving forward, KKH will work with other hospitals to look at the long-term outcomes of babies infected with COVID-19, even possibly following up with them a few years down the road.